Hello, and today we're continuing with our casual conversations. And today I am joined by Shonda Brock. Hello, Shonda.
Hello. I'm glad to be here and glad to share anything I have to give to help folks out.
Great. Well, today we're actually talking about transitions where adult children are helping their parents. Can you start us off by giving us your thoughts on why it's important for adult children to think about how to help their parents transition responsibly and care for them as they age?
I want to tell you this is my passion to talk to as many people about exactly what you said. How do we help mom and dad transition in that last quarter, so to say? And I want to start with telling you a little bit about myself. I have been in this business for several years. I've heard over 300 families and their stories and helped them out through this process. And I've touched about 5,000 lives over the duration. I first started off in medical sales with cardiac devices. So there's my senior population getting a pacemaker and defibrillator. And then I owned my own company in companion care, and I helped tons of families, especially during COVID, when I saw families have to make really critical decisions, and sometimes without the help of talking to their loved ones because they may have already slipped into a coma. So these are some of the reasons why I say let's start talking early. As well as I'm active on a lot of boards which talk about senior care, but the other thing is caregiver burnout. And as I say all of these situations with the families that I've helped and all the families that I've met, and when we talk about caregiver burnout, it always starts with one huge factor, and that's having a good conversation about how do we transition. How, when you have that conversation, that's when we're setting up expectations and understanding our parents' wishes. And that sets us off for setting us up for success. And I want to let folks know I'm not talking about dying because people automatically say, well, are we talking about what mom and dad want for their funeral? No, 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 no. I'm talking about how do you talk to mom and dad about how they want to live their life when they can't live alone? Because there's a lot of life right there, and we all need to be on that same sheet. And we most importantly need to understand what are our seniors' wishes? What do they want? And so that's why it's so important. So thank you for asking me that question because that's my that's my soapbox right there.
Right, right. And putting in place everything that needs to be in place for
Mhm.
that to happen on so many levels,
Mhm.
right?
Exactly.
Right.
Exactly.
Well, how would you say someone should start this kind of process?
You know what? It starts with a simple conversation. It starts with just as I said before, asking mom and dad, where do you want to live when you can't live alone? You see what I mean? That immediately takes that conversation away from dying to talking about living and
Right,
talking about what are your wishes. So where do you want to live? Who do you want to make decisions for you? If I have to speak for you, mom, tell me exactly what is it that you want to have happen. And
right,
let's start talking about, and I know you know all of these because this is in your lane. Let's start talking about health proxy because it's very rare now that you can go into a doctor's office and that's not one of the first pieces of paper they slide across the counter, to you as a patient, who's your health proxy? Because
right.
right now, with everything being so automated, they want to be able to reach out to another family member if they can't get a hold of you. And so that's an excellent time to talk about power of attorney.
Right.
Again, who do you want to speak for you when you can't speak? And one of the things I love to say is it can be multiple people. You know, it doesn't have to just be one child, it could be two children. But it's
Right.
great to have these conversations early,
Mhm.
so we can start laying the groundwork and start, and again, my favorite word, and I'll probably say it several times, setting the expectations,
Right.
of
Yeah.
what your parents want. And so therefore we can start acting out on them. Um, my other thing is, and this is kind of, I don't know if you've heard this before, but Who do you trust in a
Right.
time that when you may or may not be able to speak properly? And I say this because dementia now is one of our newest diagnoses that are coming out. And in healthcare and even in the legal field, I love to hear some of your input on that. I don't think we quite fully have all the structure in place. And so this is one of the things that I'm passionate about is starting to talk to adult children about that diagnosis that they get about of dementia because people get a little confused when they get that diagnosis just didn't happen then. So if I go to the
Right.
doctors and they come back and say, Shonda, you have Alzheimer's, it didn't start today. This
Right.
disease has been present for years. And so
Right.
I go back to that first question you asked me. Let's start that conversation as we transition, especially when we hear that word dementia, because unfortunately the mind is going to start slipping. And
Right.
so, with that, let's start pointing out folks that can be helpful and then say, hey, do you trust me if you get this diagnosed to speak on your behalf?
Right. Get in front of the problems, in front of a
Hmm.
potential crisis. Right.
Exactly, exactly. And I'm glad you said that, Ruth, because everything that we're talking about right now, these are tough conversations.
Yeah.
They're emotional conversations. And even when we get it right and we start having these conversations early, they're still tough. They are expensive sometimes, emotionally and financially. But I'm sure you can attest to it, Ruth, in your stories. I can attest to it in mine when we wait too long and we have to act after a lot of things have happened, the cost, whether it be financial, whether it be the emotional expense of all the feelings that are out there, are much, 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 much higher. So
Right.
I tell folks if we talk now, I know it's hard, I know it's tough, it may even be expensive, but take it because if we
Right.
wait and get down the line, put a multiplier on there. I prefer an exponent of like 25 because it's off the charts. And
Yeah.
now we're fighting, trying to get paperwork in order. We may be fighting with siblings over things versus being in the moment with your
Yeah.
parents.
Yeah.
You know, that's what's important, right? So we
Right.
can get all these other things done and decide. Now we can be in the moment.
Right.
And
Right.
so I always say,
And
let's start that talk early.
right. Having some key pieces of legal documents in place, as well as conversations, and really be in front of all of the crises that could
Mhm.
possibly just cause everybody incredible turmoil, grief, financial disarray,
Mhm.
and all of the rest. So
Yeah.
everything you're saying is totally what I understand. And it's very interesting to hear your perspective and everything that you've been through. Tell us when someone should consider home care as an option.
That is an excellent question. Because I can tell you after COVID, nobody is interested in living in a facility because I think it's still all in our minds. And believe it or not, just this morning I was out in, I think, Tonawanda. We were doing a tabled event. And I'm going to tell you, seniors came by my table I run a licensed home care agency. And the only thing they were interested in picking up were pens and pads and some candy because to be honest, a senior is never quite ready to say, I'm ready for a stranger to live in my home or to visit me in my home and help me take a shower. That's a very personal thing. And so I say to folks, when we start having that conversation of wondering when is a good time to have home care in, let's step back and look at the big picture. You know, has there been a fall lately? You know, have there been situations that you've noticed that your parents have gotten into an unsafe situation? And so, would having a caregiver be essential? Would it have helped or changed that moment? And if you answer yes, then it's time to start thinking about a caregiver. I can tell you how healthcare looks at it. They have small white papers based on this. So they've kind of proven this. Just 15 hours a day of home care, number one, increases the quality of life in our seniors. It decreases admissions into the hospital. And if for some reason they do have to go to the hospital because we can't control things, their length of stay during the hospital is decreased. when there is home care involved. So I know this is a very subjective and sometimes sensitive question about when do I allow somebody into the home? But I say, look at the signals, understand, and then don't be afraid to start implementing that and having that conversation again with your parents about, can we bring a caregiver in for a couple of hours? A couple of hours, maybe every other day. It doesn't have to be every day. It doesn't have to be all day long. It could be during those crucial times where a fall is most likely to happen. And I'll tell you, the falls 80% of the time happen in the bathroom while taking a shower. So we can start gauging, maybe we line something up around that time. So,
Right. All right.
very
Can
good
you tell
question.
us? Yeah. Tell us a little bit about how home care works.
This is always a surprise because most adult children think that their parents' insurance pays for it. And in most cases, if they're on Medicare, it does not, unless it's an acute situation where maybe mom or dad have gone in, had surgery, and then they may have had visiting angel, excuse me, not visiting angels, visiting nurses come on to take care of a couple of wounds, and there may be a little home care. But that's under an acute situation. It's usually 90 days or less, and it's an extension of the service from having the procedure in the hospital. Currently, the way we handle home care is either private pay. It is covered by Medicaid, and there are several different organizations, that will provide support, but all under Medicaid. One of the ones people most hear about is the Consumer Directed Program. When you hear the commercials, you can have a loved one, be in the home to help take care of you. That's a Medicaid program. And so when we start talking about how to spend our monies, I say, let's look at the whole picture. Let's look at the diagnose, because we want to be able to extend um, other people's monies before we start reaching in our pocket to start spending our money. So when we look at home care, like I said, it's provided by Medicaid, private pay, the CDPAP program. Um, and I know I was forgetting one. For those folks that have purchased insurance, there's like, and I can't think of any right now. You know how your brain goes blank. But there are certain insurance policies in which people are buying into, and they can get X amount of hours of home care.
Yeah.
Do you know what I'm talking about?
Right.
They are great programs, but I challenge all of my adult children, please read into those programs and don't wait until the last moment, because a lot of time those programs, they switch owners. And when they switch owners, they switch, what's the word I'm looking for? How do we start the process out?
Right.
Because when you call in, you say, hey, I'm looking for home care. We've been paying into this policy. I like to have this. And then their answer is, we need to send a nurse out to do an assessment. That takes time. And a lot of these policies will say you must pay out of pocket for home care for the first 30 to 60 days. They will reimburse you, for that, based on what diagnosis and what the true needs are. Their nurse assess when they go out. So I'm
Right.
not knocking those programs. I think they're excellent if you can buy into them at a decent rate, but understand the details, because the
Yeah.
devil is in the details, and
Right.
there may be, some things you need to line up appropriately for that.
Right.
As
Part of all
well
the
as,
planning.
I would say, keep an eye to make sure they don't change the rate on you, because
Mhm.
sometimes when they change owners, they increase the fee and can get a little expensive.
Right. Right. All right. So part of all of the planning that you would be thinking of doing ahead of time, right? So you're
Hmm.
prepared. So can you give us a little bit of information about how a home healthcare agency works?
Yeah. How do we work? As I said earlier, Medicaid pays for home care. And I like to say Medicaid is for seniors, because it's just not home care that is covered under Medicaid. So they do support our seniors and our disabled. So I tell folks immediately, do not be afraid of that name. Actually embrace it, because life is a long time. And as I said earlier, we got to dabble into each buckets to make sure we can extend our finances. So most home care companies, either they are companion care, which means they have caregivers that can come into your home and assist, but they can't, let's say, give out medications. They can't assist in the shower. Um, they are insured, but they're not necessarily licensed to provide medical care in the state of New York. Every state has different regulations, but New York, they have theirs. And so when you look at a licensed home care agency, they have caregivers. All of their caregivers are certified. They have a license because they have taken a test or they have had a class for 5 weeks or for 4 weeks. They're PCAs, HHAs, CNAs. These are some of the names that you hear thrown around. But those agencies, number one, can bill Medicaid for your care versus a companion care company that's strictly out of pocket. And just FYI, I don't want to make anybody too nervous or upset, but the ranges to pay for private pay is anywhere from $32 up to 36. And that's just the basic stuff. When we start talking about needing a nurse to come in and we're doing private pay, the numbers go up immensely. So again, I'm always looking at the total picture and how do we and where do we put our money so we can get the biggest bang for the buck. But back to the licensed home care agencies, they are supported under Medicaid and we can hit that. That's why I try to direct folks, to be under Medicaid. And then I mentioned earlier the Consumer Direct program. That's a Medicaid program in which you can hire a friend or a family member to come and support. Um, I love these programs when it's a good fit, especially for areas outside of the metropolitan area, because that's where a lot of the caregivers live. And so when you start looking, and I live here in Western New York, so I'll call some areas out. When you start looking at beyond Darien Lake or beyond Wheatfield, we have some beautiful little counties, all in and about, especially right now with the change of seasons. Beautiful to look at, beautiful to live in. But when you live out in those areas, sometimes you're going to be hard pressed to get home caregivers to be in those areas. And that's when I say, let's look at the consumer directed program so we can be a little less stringent in trying to find somebody to come into your home to assist.
So much information. All right.
Mhm.
So, what's the number one point that you would like to leave people with as far as some of the things that you covered? What's one thing to really remember and keep in your
Mhm.
mind if you've listened to
Mhm.
this?
The number one thing, I led with it in the first question, and Ruth, I'm going to close you with it as we end our talk today. And I hope you invite me back.
Of course.
But talk early. I cannot tell you how important it is to be able to have these conversations and try to figure out what is it that your senior, and we'll just hit it right on the head. What does mom and dad, what do they want? How do they want to finish those years out? It takes so much pressure off of you when you know what their expectations are, because sometimes you're not going to be able to follow it, but at least you know, and you try to get as close to it as you can. And something that I don't want to happen to anybody, but it may, I'll share with you, it happened to me. And I'm in this business, have been in this business for years. My stepfather last February, I had to go home to Florida and I'm his health proxy. And I wasn't expecting him to pass so soon. So I didn't quite have that conversation before he got too ill to have it. And here I was standing over his bed talking to the physicians, and they're asking me, is it time to get hospice? And potentially, I'm not going to have him in 72 hours. And I was floored. And as I said, Ruth, I've been in this business. I've coached so many families. And here I am standing over my stepfather having to make a decision because they were thinking about putting another port in. Should we do that procedure? And oh, by the way, I'll tell you his diagnosis. He did have dementia. He had Alzheimer's. He had heart failure. So he was on his third ICD at the time. That I mentioned he was diabetic, but he had lost so much weight, he was not on insulin anymore. So I was asked, do we do surgery to put a port in to keep him alive? but his quality of life wasn't there anymore. And then the dementia had set in, and so I couldn't really have that conversation. And so here I am, do we extend life, which there wasn't going to be a good quality of life, or do I bring hospice in and potentially have to say goodbye in less than 72 hours? And I had to make that decision in that moment. And I was so disgusted with myself that I hadn't had that conversation with him. And I should have led with that. And so, again, how we started the conversation with, how do we transition the reins? How do we get in? I say, start that conversation. And I understand it's going to be tough. And I understand sometimes there might be an argument because maybe your parents aren't ready to have that conversation. As I shared with James, my stepfather, we couldn't. But if you start early, maybe your parents get mad and maybe they say, I don't want to talk about it now. And that's fine. Put it down, but bring it up in another 2 weeks or bring it up next month. Continue to chip away at it.
Right.
I will advise, do not jump up at Thanksgiving at the table and announce in front of everybody, hey, mom, dad, what's your long-term plan? Where do you want to live? Where's your will? Those are very personal conversations. So please pick and choose and be mindful when you start to have those conversations with your parents that maybe, at the holiday table in front of the whole family is not the best time. Kind of catch them alone, because sometimes as you dig deeper into these conversations, we're starting to talk about finances, different key accounts, where that information is, all those good things. That's very private, and I know my parents, they're not one to have that kind of conversation, in a public place, in a restaurant, and definitely not in front of the whole family. So just be mindful of that. Pick and choose where, and do not be afraid if it does break down into an argument. Just disengage and then return to it another day, because sometimes it just takes your parents to kind of understand where you're coming from and how this can be helpful for them. And I would even say the next time you bring it up, maybe bring in a scenario, of something. Maybe you guys watched a movie together, and maybe there was a scene in that movie, or maybe there's a friend that had been in the hospital and maybe things went kind of sideways. And then you can say, hey, mom, what if that was you? What would you want me to do for you? Or hey, mom, we just got through COVID and I was living in Florida. You were here in Western New York and Buffalo. Have you been thinking about, hey, do you want to come down and live with us? Because, I felt so isolated, like I couldn't help you and I wanted to be there for you. So, break it down that way and let them digest it. Because again, I don't want anybody here to think I'm talking about dying, because I'm not. I'm talking about how do we live our best lives. And we've got to have these conversations early so we can be in the moment and be ready for when death does come. But I want to lead the conversation on how do we live and how do we live now and how do you want to live later. So that's it, Ruth. That's my
Shonda,
passion.
wow.
And
Well,
this is
thank
what
you
I
for
like to
sharing
do.
that personal story
Mhm.
and what information that you have and experience that you have. And thank you for sharing so much with us. And I would love to have you back and we'll talk some more and go into some more depth with some things. So thank you so very much.
Thank you so much for the invite. Anytime, any place. I'll get on my soapbox because, again, I want to help as many families as I possibly can to
Yeah.
live their best lives.
Yeah, that's what it's about, right?
Mhm.
Well, I just have to say this video, as with any video I do put out, is for educational purposes only. It does not establish an attorney-client relationship, and I look forward to seeing you on another video.